I think we are live. So welcome everyone. This is Aparna Mittal, founder, PatientsEngage, and moderator for today's session. The month of May is Bladder Cancer Awareness Month, and we are here to talk to very senior doctors on, on the symptoms of bladder cancer and how do you get it diagnosed, what are the common mistakes people make, and what types of cancers exist, and a little bit of information. This is part of a series we are doing over the month. The theme this year is "Don't Go Red, Go to a Doctor." So don't miss the symptoms is really the focus of this theme. Bladder cancer is a cancer which is rarely spoken about, and there's a lot of stigma and shame associated with it. And that's why we think it's important to do this series so that people can feel informed, engaged, and empowered to deal with bladder cancer. And that's always our focus area as PatientsEngage. For those of you who are looking for personal experiences of people with bladder cancer, you can also check out. We've got a couple of webinars from the past on dealing with the psychosocial effects of stoma bags and bladder cancer, and even some side effects like lymphedema. And because smoking is a key factor and a risk factor for bladder cancer, it's also good to learn how to quit smoking. So that's another one that you can find. Reminder to our attendees, this session and this discussion does not replace a medical consultation. This is for awareness, so please do consult your doctor for specific medical issues or with these doctors separately if you would like to connect. This session is being recorded, and if you're logged into Zoom, you can post your questions on the Q&A. If you're on Facebook, YouTube, you can post them on the live feed and we'll pick them up. And since we are doing as a series, if you have questions which you would want us to pick up in the next few sessions, you can write to us at editor@patientsengage.com and follow our social media pages so that you don't miss any of the following sessions as well. We are very privileged to have with us a couple of very senior doctors. As I said, we have with us Dr. Pramod Kumar Julka, who's the Principal Director, Oncology, Max Institute of Cancer Care in Lajpat, Nagar, Delhi. He received his higher training at MD Anderson Hospital, Houston, under a WHO fellowship, and thereafter he was at the Long Beach Memorial Cancer Center. He was also Dean Academics and Professor at Department of Radiotherapy and Oncology at AIIMS, New Delhi. He's former President, Association of Radiation Oncologists of India, Northern Chapter, former Chairperson of Indian College of Radiation Oncology 2000 to 2009, Lifetime Achievement Award, Association of Radiation Oncologists of India 2013, and recipient of the Padma Shri Award, which, as all of us know, is the fourth highest civilian award in the country. We also have with us Dr. Jyoti Wadhwa, Director Medical and Hemato Oncology, Medanta Cancer Institute in Gurugram, trained at premier medical institutes in India and at the Imperial College of Medicine, Hammersmith Hospital, London. Dr. Jyoti Wadhwa has received clinical training in hematological malignancies, including stem cell transplant. She has subsequently served as the Assistant Professor of Medical Oncology at IRCH at AIIMS, and she's the Deputy Secretary of the National Academy of Medical Sciences, India. She's also authored a book on breast cancer and has worked in associations such as the Indo-American Cancer Association, the American Society of Clinical Oncology, and the European Cancer Society of Medical Oncology. So as you can see, we have with us very, very senior oncologists here, and who have taken the time to educate patients and the general public on bladder cancer, which is hardly spoken about. And this is being supported in public interest by Merck and Pfizer Alliance, which is committed to improve outcomes for patients. So with that, I will get started right away. And for all of you who are watching, as I said, you can ask your questions. So let's get started. Dr. Julka, what is the urinary bladder as far as a layperson is concerned, and where is it located and what is its function?
Actually, if we say urinary bladder, let me start with the perspective of the cancers in India, first, because people should know that we have a National Cancer Registry project. And I was in charge of Delhi Cancer Registry when I was in AIMS. And under the National Cancer Registry project, we have about 14 lakh new cancer cases every year. And out of which 40% are tobacco related.
Right.
And urinary bladder is one of the cancers which is tobacco related cancer.
Correct.
So I must say urinary bladder is in the pelvis. Pelvis we call, below the abdomen, which lies and from where we pass the urine through the urinary orifice. And then the urine collects in the urinary bladder. And whenever, smoking or any other chemicals, the symptoms as we call of urinary bladder cancer, first and foremost warning sign is blood in the urine. It is called hematuria. Hematuria means blood in the urine. Whenever you see a blood in the urine, you must go to your doctor and never neglect it. Never, never. And you might have some other symptoms also, like feeling an urge to urinate at night more times, but you are not urinating, or sometimes you are urinating too much, and sometimes you are having backache, sometimes you are having pain in the abdomen. So all these symptoms should not be neglected at all. Why they should not be neglected? It can be anything. I'm not saying that all these are symptoms of cancer, but we must not neglect them. We must go to our doctor and then show to our doctor and then consult the doctor whether it is cancerous or non-cancerous.
Right. Thank you. Thank you, Dr. Julka. Dr. Jyoti, are there any other symptoms or signs that you would like to add, and how does this cancer affect the functioning of the organ?
So as Dr. Julka rightly mentioned, that the commonest symptom or presentation is in fact painless passage of urine, blood in the urine. So that's the commonest, but depending on the stage of the disease, there could be more symptoms also to suggest, which site other than the bladder could be involved. So
Right.
There could be low backache, there could be involvement of surrounding structures, thereby leading to some sort of difficulty in passage of urine, so-called obstructive urinary symptoms. If the cancer has spread to distant body parts, then depending on where the cancer cells have spread, there could be additional symptoms. So if it has spread to the, say, lymph nodes in the tummy, and the lymph nodes are big ones, they could lead to abdominal pain. If it has spread to the bones, the patient could have bone pains. If there's extensive involvement of the liver, there could be jaundice. If it has spread to the lungs, there could be cough or breathing difficulty, so on and so forth. But till the time it is limited to the bladder, the most common presentation is blood in the urine or frequency of urination. Sometimes the passage of urine could be a painful one, so that could also be suggestive. So the symptoms actually depend on the stage.
Right. And typically, Dr. Julka, how do you differentiate this? Because often when there is a little bit of urine related issues, people assume it's urinary tract infection, right?
Yes.
So
Yes.
the commonest assumption is that it's UTI. And in some cases, they might assume kidney infection. So, how is the differentiation done?
Yes, people feel that this is a urinary tract infection and they go in for urine testing, routine microscopic, and then they go in for urine culture and sensitivity. And sometimes they also find that there are organisms in it. There is actually a urinary tract infection. That also people have found, and they do the culture sensitivity assay and they keep on taking antibiotics after concerning GPs and not going to a professional, doctor who is a urologist or any oncologist. So this is what I want to highlight, that you must go to your specialized doctor whenever you have such symptoms. As Jyoti also said, painless hematuria. Sometimes you may not have pain. So
Correct.
we always used to say painless hematuria, you must not neglect. You must go to a specialist who will diagnose you, and don't take it as UTI only.
And is there, because again, we are a large country, we don't have enough specialists, etc. You know, is it okay if your first line of treatment is, going to a GP and treating it like UTI, but then is there a, do you try it for 1 week, 2 weeks, and then if it doesn't? So what is the guidance on that to people?
Actually, sometimes, most of the people go to GPs and then they get 1 week treatment. If they are not fine, they sometimes change the drugs also and
Right.
continue with the UTI treatment. But GPs also are now becoming aware of this, and they are sending the patients to urologists in these
Okay.
cases, and who diagnose these cases as urinary bladder cancer.
Right. So Dr. Wadhwa, how is, sorry, go
I
ahead.
add one thing here itself, as Dr. Julka was saying. So it's very important to have platforms like the current one, the one that you are holding right now, to raise the level of awareness amongst not only public, but also general practitioners,
Right.
In fact, there could be coexistent urinary tract infection and bladder cancer, right? But somebody may not get diagnosed with bladder cancer because somebody did not even suspect it, because the doctor did not even suspect it. So
Correct.
it's very good to be aware that this is also a possibility, even though it may be 1 on 10 that it could be bladder cancer, but it's good to be aware, right?
Right.
Yeah.
So yeah, my question on that was, how is bladder cancer diagnosed, Dr. Wadhwa?
Yeah, so the bladder cancer could be suggested by as simple as a urine cytology test, wherein the urine sample is centrifuged and the sample is then examined under the microscope for any abnormal cells or cancer-looking cells. That's the initial step. And beyond that, there are more sophisticated tests. So there's a test called cystoscopy, wherein an endoscope is passed from urethra into the urinary bladder, and the doctor examines the inner lining of the urinary bladder. So that's called cystoscopy. If the doctor sees any abnormal area, any abnormal looking area, any lumps, then the doctor will take a biopsy, and which would again be examined under the microscope, and that would confirm or rule out the diagnosis of bladder cancer. Once a diagnosis of bladder cancer is made based on cystoscopy and biopsy or urine cytology, then there are more tests like CT scans or MRI or a whole body PET scan to know the extent of disease. So that's called staging work.
Right.
So all these tests are ordered sequentially by the specialist to diagnose urinary bladder cancer.
Thank you. And Dr. Julka, how common is bladder cancer? Because again, it's one of the cancers that hardly gets talked about.
Yes.
So there's a feeling that it's not very common, but how common is it? And typically what percentage gets diagnosed early stages versus late stages?
Yes. We are getting more and more cases of urinary bladder cancer. And if you see the cancer registry data, again, I'm coming back to the registry, the Indian Cancer Registry, it is 3.7 per 100,000 population. The incidence, we always say, per 100,000 population in males and 0.83 per 100,000 population in females. It is more common in males.
Right.
Cancer. They are more smokers, as we say, males smoke more. So besides smoking, we have certain chemicals which are responsible for urinary bladder cancer. And we have certain parasites, schistosomiasis, we call it, which is in Africa, not in India. But that might also lead to urinary bladder cancer. So there are various, causes of urinary bladder cancer. And whenever it is diagnosed, we always say, as Dr. Jyoti also told, GPs also, we try to educate them on every cancer. I'll give you one example besides urinary bladder cancer, the lung cancer.
True.
Lung cancer was being treated because this is one of the common cancers.
Correct.
Lung cancer is invariably diagnosed in stage 4.
Right.
Why is it diagnosed? Because GPs sometimes keep on treating as tuberculosis, because tuberculosis is commonest in India.
Correct. Correct.
And that is what I am saying.
Yeah.
So GPs have to be aware of the signs and symptoms so that they could refer the patient immediately to the specialist who could diagnose this cancer at an early stage. Early stage means muscle non-invasive, and we have muscle invasive cancers. So if you diagnose at early stage, you are liable to be cured early. Early stage is the hallmark to cure.
Right. Right. Thank you, Dr. Julka. So, Dr. Wadhwa, what are the types of bladder cancers, and is that dependent, and also the staging of the cancers?
All right. So when we say types of urinary bladder cancer, what we mean is the type of cells that are seen under the microscope. So there are 3 types, and the most common amongst those is the urothelial cancer, also called the transitional cell carcinoma. So that's the most common. And the other 2 uncommon types of bladder cancer could be squamous cell carcinoma and adenocarcinomas. So as Dr. Julka was mentioning, in terms of the risk factors or causes of bladder cancer, so that parasitic infection, which is fortunately not prevalent here in India, but is found in some other countries, say Africa, schistosomiasis, that leads to chronic irritation leading to squamous cell carcinomas. But the most common type is transitional cell carcinoma. Coming to the stages of bladder cancer, there are stage 1, 2, 3, 4, and there's a stage 0 also, which is carcinoma in situ, wherein the cells have not yet breached the basement membrane. They are sitting there just on the initial few lining cells. Stage 1, when it has gone beyond the basement membrane into the connective tissue lying underneath the lining mucous membrane. Stage 2 would be when it has started to invade the muscles, because we know the urinary bladder is a muscular organ, as Dr. was mentioning. So then it invades the muscle layer. Beyond that, in stage 3, it has gone across the muscle of the urinary bladder, gone on to involve the surrounding fat. It could invade the surrounding structures like prostate in men. It could also affect the seminal vesicles in men. And similarly in women, it could involve the surrounding areas. It could also have spread to the lymph nodes in the lower part of pelvis. So that's stage 3. Once it has gone beyond all this, it has spread to distant body parts or the lymph nodes beyond a particular level, it's called stage 4.
Right.
So that's when it becomes incurable, and the intention of all our treatment becomes palliative. So it's very important to get diagnosed in early stages. When it has best outcome would be when it has not even invaded the muscles.
Right. And therefore, obviously, as Dr. Julka, as the staging varies, the treatment choices also change, and what are the protocols they change? Right.
So treatments are entirely dependent on the stage of the disease. And we as clinicians, we have a team of doctors. So there's no one doctor who would treat bladder cancer. It involves multi-modality treatment, wherein we have urologists, uro-oncologists, we have radiation oncologists, medical oncologists like me, and other supportive staff who would sit together and make the best possible treatment plan of a given patient. We would take into consideration the stage of the disease, the age of the patient, the performance status of the patients, whether the patient has any other medical conditions, which would hamper the taking of the treatment, and then come out with the best possible treatment and take it to the patient from there. So it's a multimodality treatment, and depending on the stage, we may offer only surgery. We may offer a combination of chemotherapy and radiotherapy followed by surgery, or it may be entirely palliative medical treatment, wherein we could use chemotherapy, targeted therapy, or now immunotherapy. So that's the most recent advance which could be offered to a given patient.
Right. Okay. Thank you. And when, one of the things that worries most people when they hear of things like bladder cancer is the removal of the urinary bladder, right? So can a person lead a normal life after removal of urinary bladder? Dr. Julka?
Yes, actually nowadays, we have treatments where bladder may not be removed, but most of the cases they remove the bladder, and in some of the cases they put neo bladder. It is called neo bladder, where the bladder is put in the same position as the normal bladder would be. And sometimes they put a tube which people don't like, to put in here because it's a social stigma.
Correct.
That way, people are afraid only of removal of urinary bladder. And nowadays, we are trying to devise treatments which can, allow us not to remove the urinary bladder. And later on, I think with more targeted therapies, with more molecular therapies, we are going in for molecular profiling of the tumor. And as Jyoti also said, about immunotherapy has come a big way, and we have antibody drug conjugates, antibodies combined with drugs, and we got very good responses even in stage 4. I have used them, saying what we are using. So that is why, this is how science is advancing, and I think by another 5 or 6 years or maybe a decade, we will have achieved that. We would have achieved that.
Great. That is really good news. So, if you look at how science is advanced, what is the prognosis now for a person with bladder cancer?
Now, prognosis would depend on the stage of the disease. As she said, it is stage 1, 2, 3, 4, or maybe in situ carcinoma. In situ means that it is stage 0.
Right.
So earlier the stage, better the prognosis. That is for every cancer, even urinary bladder cancer. And that is why we say that early detection is the hallmark to cure. Why we keep on saying this? Because please go to a specialist early so that you are diagnosed early and you are treated and you are cured. Cure rates are higher in early stages than in late stages, where we can hardly do anything. And we, even though we improve the quality of life, try to improve the quality of life, by giving various combination of drugs, chemotherapy, immunotherapy, because immunotherapy has come a big way in maintenance. Initially, if we give chemotherapy and if we get a complete response or a partial response after say 4 to 6 cycles, then we have maintenance immunotherapy. This is a new thing which has come. Maintenance immunotherapy means we are maintaining the patient with immunotherapy.
Right.
So this is
almost treating it like a chronic condition then.
Condition, and we are going to make cancer a chronic disease like diabetes and hypertension and treat it like that. You keep on taking pills like targeted therapies and keep on living your life normally, going to your office, going everywhere,
Right.
But smoking should be avoided,
Yeah. I think we have a question as well from somebody. They would like to know about blue light technology and if it's available in India. Do either of you want to take that question?
Blue light technology is not available, as we know in this part of, it's not available.
So so I'm not aware as to where it's being done, but basically it's blue light cystoscopy. So wherein a fluorescent medium is used to pick up the bladder tumor more clearly and therefore remove it better. So like there's a cystoscope put in for TURBT, transurethral resection of bladder tumor. So if you use this blue light or a particular fluorescent solution along with it, then the removal is more complete and the chances of therefore local recurrence would be less. But I'm not aware as to where it's being done.
Right. Thank you. Thank you. Are there any gender differences in terms of either the way the cancer spreads or the way it is treated? I know that you said that it's much higher in men than in women, but is there any difference in either in terms of presentation of symptoms or in terms of treatment choices?
No, treatment choices remain the same, whether it is in males or females, but incidence is more in males than in females, as the data also shows. And we also know that in males, they have more of urinary bladder cancer. And clinically also, we see more of males coming as urinary bladder cancer. So that's why the incidence is more, but treatment choices are the same, depending on the stage of the disease.
Right, right. Okay. And if do you often, because we also deal with patients with other cancers, is bladder cancer ever a secondary cancer as well?
Bladder cancer is mostly a primary cancer.
Primary. Okay. Yes. All right. Thank you. I think we're pretty much reaching the end point. So any final words for our audience, to ensure
the final
early diagnosis and yeah.
One final word I would like to say, please avoid smoking, number one. Number two, just a few seconds I'll take.
Sure, sure.
Avoid smoking. Number two is avoid dealing with chemicals. If you are working in a dye industry, aniline dyes, we used to call it, if you are working in that industry, please be sure that you are not in contact with the chemicals or you are not inhaling the fumes of the chemicals. And in India, the schistosomiasis, as I told, parasitic infection is not common. It is in Africa, where we have been telling people in Africa also to beware of that infection. And secondly, I always used to say that please, any symptom comes, go to your specialist, whether it is cancer or not. It is for the specialist to decide, not for you to decide. And don't ignore it as a UTI only. UTI may coexist with cancer. That also may be there. So please go to your specialist.
Thank you. Thank you, Dr. Julka. Dr. Wadhwa, would you like to add
your
final words?
With what Dr. Julka just said. Avoiding the risk factors, and most important, the top of the list is avoid tobacco in all forms, avoid exposure to the various known chemicals. Also be aware through various media, presentations like this, read about it, learn from your doctor, and don't lose the first opportunity. Once there's any symptom suggestive of bladder cancer, as we discussed in great detail, don't ignore, don't sit over the symptoms even for a week. Go to your doctor, get yourself evaluated. And finally, don't be fearful of cancer, because cancer is 100% treatable. It's curable if detected early. So don't be fearful, be hopeful, be aware, be optimistic. So that's my message to all the audience today.
Thank you. Thank you, Dr. Wadhwa. Just one final question. Somebody has asked, is bladder cancer genetic? Is there any blood test, CEA or CA19?
Actually, no, these are not the markers for bladder cancer. Sometimes, we do these markers to detect other types of cancers or inflammatory conditions also.
Right.
In some of the, inflammatory conditions they occur. But it could be genetic. That is known. Bladder cancer could be genetic, but you get yourself treated as even if the symptoms appear, please go to your specialist for early detection. That is
Yeah,
what I will. And cancer is not a death warrant. Please know,
correct.
cancer
Correct.
is curable if detected early.
Thank you. Thank you, Dr. Julka. Thank you, Dr. Wadhwa. I think it is really important for the audience to know the symptoms of, urinary bladder cancer. I think the doctors have highlighted that quite clearly, and to stop tobacco and to be aware. I think that time and time again for all of our sessions, we are reminding people that cancer is increasingly much more treatable and curable. So do not delay that test or that consultation with a specialist. And just a reminder for everybody, tomorrow we are talking specifically on navigating treatment options for bladder cancer at 7:30 p.m. with Dr. Kumar and Dr. Tushar Patil. And once again, Dr. Julka and Dr. Wadhwa, thank you so much for your time, and to Merck and Pfizer for supporting this initiative, and to the audience for listening in and making efforts to, inform themselves and empower themselves. So thank you so much.